Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of Dr. Ashley and the Boss. And believe it or not, Dr. Ashley's actually in studio. Where have you been, Dr. Ashley?
I'm sorry. I've been a little bit ill under the weather, but back today.
Well, the audience has been complaining. They've had to deal with me solo. The show has gone off the rails multiple times. But thank you for coming back.
Thanks for having me back.
Absolutely. And in studio, we are thrilled because we have just started our series where we are paying attention to our agency directors. We just finished a series when we were introducing the community to our board members, but we really want folks to know about our agency directors because they're so vital to what we do. We partner with them every year for all the important services. So in studio is Mr. Rick Ford. Welcome, Rick.
Thank you. I'm glad to be here. And I'm so fortunate because Dr. Ashley's back in studio.
Yes. You wouldn't have had a good time if it was just me. So Mr. Rick Ford is the executive director of ACADA here in Ashland County. It's a long-term, long-standing agency in Ashland County and a long-time partner of the Mental Health and Recovery Board. So hopefully, as we get through the questions today, and Dr. Ashley is going to help me with the questions. Rick, we're going to get to know you a little bit more, as well as the services at ACADA. I've asked you to think through some of these questions we're going to ask you. So I know we can't talk about all the services that ACADA provides to the community, and there are quite a few, but we are certainly going to give you some opportunity to brag on a few services. So maybe first and foremost for our audience, maybe tell us a little bit about yourself in terms of maybe education and experience.
Okay. I went to undergrad and grad school at Ohio State University.
Go Bucks.
Or I should say the Ohio State University.
Yep.
So, I got my bachelor's in social work in 1993, and then my master's in social work in 1994.
Awesome.
Yeah.
Great. So have you lived in the area pretty much most of your life? Because I thought there for a while you had left the state. I don't know if that was voluntary, involuntary, but you left for a little while.
I did.
But that was good experience, I think. We've talked about that.
Yeah, absolutely. So, I grew up actually in Richland County, and then I went to Lexington schools, and then from there moved to Columbus. Was in Columbus for probably 12 to 13 years, and then moved to the East Coast, where my wife is from, and we lived in Rhode Island for 18 years.
Yeah.
So I've been back in this area for the last 4 years.
Okay.
See, I didn't know that. I thought you were from the East Coast, so it's good we do this.
Mm-hmm. Right.
Yeah, that's very cool.
Yep.
So how long have you been with ACADA, and how many years have you been in your current position, Rick?
So I've been with ACADA since August of 2020, so it'll be 4 years this summer.
Awesome.
And then it'll be 4 years in this role.
Great.
Okay. And again, I don't want to make assumptions. So tell the audience about ACADA, the organization itself, maybe the mission purpose. Even though it's been here for many, many years, I just don't want to assume folks know, what ACADA is all about.
Right. So the long, ACADA really is what we're known by, but the long term for what ACADA stands for is Ashland County Council on Alcoholism and Drug Abuse. And ACADA has been in an ACADA format since really the mid-1980s, but ACADA has really been around since the mid-1970s in some shape, or form and under different names and things of that nature, but really became ACADA as we know it in 1985, I believe.
Okay.
So we're predominantly known in the community for our alcohol and substance use treatment, working with individuals and families affected by, addiction. And our prevention services as well in the community.
Okay, great.
What are 2 or 3 maybe of the programs and services you'd like to spotlight today on the podcast, Rick?
Like David had mentioned earlier, we're a small organization and we have a lot of different programs. So it's really hard to really pick like 2 because they're all my favorite. However, in which the ones I really would want to speak about is definitely our prevention services. Mm-hmm. So we have 3 part-time prevention educators we're in really every school district within the county, K through 12. And we do an evidence-based curriculum called Too Good for Drugs. Yeah. So we've been in the schools quite some time. we like to call our senior prevention educator. She's been with the organization. This is her 32nd or 33rd year
Wow.
with ACADA. So and has been providing the prevention services since that time.
Wow.
And then our other prevention educators are, well experienced, well trained. They're all three very, very creative. So I'm, really proud. We reach a lot of students in Ashland County. I think last year was close to 6,000 or a little over 6,000 students directly working with our prevention educators. So that's certainly one of our assets and what we're known for. We hope to get into more schools within the districts and keep expanding that.
Yeah. As you know, Rick, your prevention gals have been on the podcast several years in a row, and they're always rock stars when they come on. So maybe I'll get them on again this summer.
Yeah, they'd love it.
Yeah.
Anything that they can do to educate
Yep.
is what they do, and they're really, for lack of better words, rock stars of prevention services.
Yeah, and I don't want to move off your K through 12 prevention, because I'm glad you mentioned that one, because to me, that, for the listeners, ACADA was not always in every district K through 12. I mean, this is a recent thing. Rick and his staff have been really trying to develop those relationships, and I just applaud you, because I can't think of a better time for your prevention educators to be in all the districts and all the levels, and having an evidence-based curriculum like Too Good for Drugs, because our kids are facing a lot of things. The marijuana being legalized recreationally has been the most recent challenge, right? And again, even though it's not legal for our young people to use, they can't help but look around them at the adults and say, what gives here?
Right.
So it's made your prevention educator's job, I'm sure, more challenging than it already was.
Right. And I think the nature of really the illicit drug scene, for lack of better words, is pretty overwhelming. And it does challenge not only us as treatment providers, but certainly the prevention educators, and really keeping up with the data and the information. And it's always changing, and they're really good about doing that and trying to intervene in the best way that we know how. Through the right information education, because there's so many different myths and about addiction, let alone what's in the drugs and what impact they'll do. I think it's just important that people understand that the curriculum that we provide is grade and age appropriate, as sequentially as starting from kindergarten, so they're not talking about more advanced substance use or how to use the substances per se. That happens in more secondary, not the primary ages, but more the secondary, middle school on up through high school, where it gets a little bit more sophisticated in the curriculum. But we do a lot of things about emotional wellness as well, social emotional learning type of curriculum. It's all built into that curriculum. So it's not only how to have help gain self-esteem, self-confidence, how to have friendships, what is a healthy friendship, all those type of things that may prevent someone from ever even starting the use of or misuse of alcohol or drugs.
That's great.
Yeah, I think that's so important. We hear so much about overdose and the damage that substance use is causing in our communities and families and individuals. So I don't think you can overemphasize the importance of prevention in the community. That's really important work.
So that's one of his favorite children. Let's see what else has he picked?
Well, the other is really our peer recovery support services.
Oh.
And because that is really such an asset for any individual trying to navigate the recovery. And everybody it's really an individualized process. There's no cookbook recipe for recovery, and everybody has their own trajectory, what direction they had. But we do have a peer recovery support person that's certified through the state that has been in active recovery herself for going on 9 years and can really walk beside them.
Yeah.
And doesn't tell them what direction to go, but can really just be an active support, informally, formally. If it takes like driving them to a medical appointment or going to a court hearing, if they have some legal issues going on, no matter what it might be, getting their basic needs met, taking them over to Associated Charities to get food. But also, kind of ties into our recovery houses. So we do, and our peer recovery support person is an active participant, support, very visible within our 2 recovery houses that we have here in the city.
Yeah. So is your peer recovery person then, is it within the parameters of her role is to, appropriately bring up, her own journey and her own recovery experiences and how that might be helpful to maybe the individual she's working with to maybe help them realize they're not alone. It's not unusual, maybe some of the things they're going through.
Right. Yeah.
Okay.
I mean, I think her most important role, or one of the most important roles, is that they're not isolated.
Okay.
And that she gets it,
Yeah.
tried and true, compassion, understanding, and non-judgmental, because, that was her,
Yeah.
a decade ago, trying to start and trying to figure out where do I take this? And, I know each of you have met Lori, and she's thriving in so many ways, despite a lot of adversity that she's experienced, and not using those adversities as an excuse.
Yeah.
Really only an explanation as to how she ended up where she ended up, but is really thriving and removing the isolation and the stigma.
Yeah.
And, even as fundamental as, like, if she does go to a medical appointment with someone that's in active recovery, being able to sit with them during that appointment to help explain to the primary care provider how they are affected by their substance use, and they're trying to get better and
Yeah.
trying to be more, more responsible in a healthier way for their own lives and how they navigate it. So there's a lot of things that they're tangible, but there's a lot of untangible things where people benefit from too.
Absolutely. I can
Yeah.
see how it's a different level of support coming from someone who's experienced it themselves. Like, it's just a different level of understanding, I think.
Yeah.
It's helpful.
And I've heard, Rick, because you've done other radio spots, and one of the things you do towards the end of each one of your spots is you talk about not judging. And I want to unpack that maybe just a little bit, because I think it's so important that you started to include that, and even mentioned as you were talking about your peer services, this idea that, recovery is made much more challenging when folks have to fight through all the judgment. They're judging themselves, but then oftentimes they're being judged by family and friends and systems because of their use, and how that can really make recovery, I think, extra challenging. It's already challenging, but so you've really tried, I think, to address that. We collectively, whether individually as family and friends, but as a community, we need to get past the judging when it comes to the substance use.
Right. Because it does affect their willingness to even engage,
Yeah.
if they sense. So I guess, if anything, that's one of the biggest plights that I've taken since becoming the executive director at ACADA, is really to try to create that culture
Yeah.
of being trauma informed, and really understanding that people can experience a lot of different adversities that may correlate with someone getting into drugs or alcohol and misusing them, becoming dependent, and also, therefore becoming addicted to anything. But it doesn't cause them to become that way, because there's a lot of people that experience adversities and never go that path. But we try to fill the gaps to figure out why this person as opposed to that person who experienced similar things. And I think you have to meet them where they're at, and very client-driven, client-centered, and everybody coming from a different place, and really having no judgment about that, to figure out what path they would like to take. And so I think the whole process is very individualized. Even on a prevention level, it gets pretty, personal at times in the classrooms, and, down to the, counseling sessions or with our peer recovery support. Doesn't matter, even really down to our administrative support staff, and having that culture and trying to cultivate that. So you're right. In my substance use minutes, I always say, let's support, not judge. Because I think, unfortunately, all of us we all know someone that's been impacted either by a mental health disorder or a substance use disorder or alcohol use disorder. We all kind of know somebody, and we've all been affected in some way or not, directly, indirectly. So, the judgment, it's not helpful.
Right, and maybe it bears repeating because you talked about changing the culture, and I think Acadia's always had a good culture in this area, but I want listeners, particularly family and friends that might be listening, that you might have somebody you know that you're close to that's struggling with substance use. Please understand that it's not unusual for them to start and stop treatment multiple times before they really progress in their recovery. And so what I think Rick has continued at Acadia is, if somebody goes to CADA, they go for a while and then they relapse. I think, correct me, but they can come back to CADA as many times as they need to come back. And you try to tell folks that and create that culture whereby, just because you went to the organization and you were doing well for a while, but then you relapsed, I think you try to take out that worry that they're going to be judged or they need to feel ashamed because they had a slip or a relapse and they can't go back to Acada if they need to 2, 3, 4, or 5 times. So
Right.
I guess what I want the audience to know, particularly if you're helping somebody or supporting somebody that's in the recovery journey, please understand that it's not unusual for somebody to start and stop multiple times. Keep going back. Agencies like Acada, they're not judging the individual. They're not going to say, hey, you've been to this agency 3 times. We can't take you back. You've
Right.
had 3 chances at this. So
Right.
I just want to make sure I'm accurate on that. But I'm pretty sure you've really reinforced the fact that if folks need to come back, you come back.
Right. It's as simple as that. And it's, we don't have 3-strike rules or anything to that effect. And I think, again, that's more of that trauma-informed type of lens or perspective, is that the door is always open.
Yeah.
And that we're not going to judge, the individual or the situation
Yeah.
that brought them back. I mean, one of our counselors that you guys know, she's been with our organization 38 years. So
Yeah.
if we were to ask her, like, how many times have you seen a given individual or a family or a generation of
Right.
family? It's multiple times, but it's like, hey, the door's always open.
Yeah.
And people can walk in really any time,
Yep.
regardless if they're actively engaged or not. But we welcome, if someone wants to walk in and get set up, we'll get them set up.
Yep. So prevention, peer recovery. Do you have a third one for us?
Well, like I say, they're all my favorites, so I'll keep it to a limit because of time.
Okay. Well, I'll tell you, outside of all the good things that you guys are doing at Acada, I understand that services, what we call community behavioral health services, don't happen in a vacuum. So I have to imagine there are a variety of challenges that, you as the executive director of that organization face. So if you maybe could share with us, because I want folks to know not only the positives that I think Ashley's going to ask you a question after this, but I want them to understand what some of the challenges that your organization is facing, and so folks are aware.
Well, and I think every organization in behavioral health probably says similar things, but obviously funding and the cost of being able to offer these services. They go up every year,
Yeah.
and sometimes the funding is what we call like flat funded, same amount of funding year after year, knowing that like cost of living, inflation, so on and so on, and to really maintain quality clinicians or counselors and staff.
Sure.
That I think that's pretty universal. I think the other challenges that we do and we don't have, because part of our mission is to influence public policy around alcohol or drugs, not only to educate the community and then obviously provide the treatment services for people that and families that are impacted by alcoholism and or drug abuse, but like the nature of the drugs is something that's a real challenge to us as prevention educators, providers, our whole system, is that it's always evolving. It gets more advanced. They get more toxic. The lethality is increasing, as we've seen with the synthetic opioid fentanyl that we've have talked about for years now, and trying to navigate that, and then how to respond to that versus react, and try to be as proactive as we can. But the drug culture, or at least on the illicit drug use on the street, they're always seemingly a few steps ahead of us. And how we respond to that, whether it's medically, therapeutically, emergencies, all those type of things that systemically get impacted. It affects the courts with more, people getting in trouble as it relates to their drugs because they are higher toxic, higher lethality, and only, I kind of talk about the 3 Ps of least illicit fentanyl, is profit. It's highly profitable, and it doesn't take much to add, mix in or what we call like laced into or pressed into a pill that may look like something, but it really has fentanyl in it. And it's very pervasive, meaning that it's in everything that we know of, and that trying to keep up with that, and that's a huge challenge as a provider, and to see what impact it's having on not only individuals but their families, anybody that's close to them, their relationships, and then ultimately, if it does lead to an overdose leading to death. And then all the effects of that.
Sure.
So those are our biggest challenges.
Absolutely. Some real challenges
Yeah,
in
absolutely.
that field. What opportunities do you see for ACADA?
Well, couple. One is really like to see an expansion of our prevention education, and being able to have more prevention educators and really expand so we can really get in every school within each district, within the county. That would be ideal, is to be able to do that, because I'm a firm believer in prevention services, and sometimes it's hard to measure because it takes a long-term tracking to see what impact it potentially has on a given student or a collective group of students and the student age population that we'd have to follow them. But ideally, I'd like to expand the prevention education services because I just feel like the demand and the need is there.
Yeah, that's great.
Especially when we do have schools asking us to come into their classrooms.
Right.
And the 3 that are existing can only cover so many hours and so many classes a week.
Exactly.
And the other is just, future partnerships, maybe with some other organizations that we have some affiliations with to be able to expand what we can do for our outpatient treatment services.
Great.
No,
Yeah.
that's awesome. And we are in studio with the Executive Director of ACADA, Rick Ford. So, Rick, we always ask at the very end, what have we missed? So it gives you an opportunity to tell the audience anything you'd like to know that maybe Dr. Ashley and I haven't asked you yet just about ACADA. This is your chance.
Oh, and this is my chance. All right. So I think, for people to know that, we've had a long-standing placement in the communities. We mentioned earlier, really since the mid-1970s, but ACADA became ACADA as we know it in the mid-80s. So, we would be 40 years in a couple of years just from ACADA. So there's a lot of experience, and I had mentioned that one of our staff has been here really since the fruition of ACADA becoming that. She's been here 38 years, and I think collectively, just between she and I, we have over 70 years of experience doing what we do.
Wow. That's awesome.
And that's not including the other staff that we have. With that being said, I think the experience and I think the culture with the emotion and the compassion and understanding, that is what we hopefully provide. That's what I wish to provide. That's the kind of culture I want to cultivate within ACADA and maintain that. And that we, for lack of we're understanding, and that we want people to feel safe and really be able to speak about the things that are unspeakable sometimes.
Yeah, that's great.
And that's real important to me.
Yep.
Absolutely. Very important. So thank you so much for being
Absolutely.
here with us today.
Thanks for having me.
How might listeners get in touch with ACADA?
Yeah, what's the best way?
Well, our office phone number is 419-289-7675. We're here in Ashland at 310 College Avenue. And our website is ACADA, so it's ACCADA.org.
All right. Well, we appreciate your time, Mr. Ford, and I know I can speak for Dr. Ashley. We've enjoyed the partnership since you've been in Ashland County. You had some predecessors that we worked well with, but you picked up the ball. And we really didn't miss a beat. Your knowledge, experience, but also your personableness has been pleasant. So
Well, I
been fun.
appreciate that.
Yeah,
I appreciate
it's been
that.
a lot of
Yeah,
fun.
I like to have fun.
Yep. Well, thank you very much.
Thank you.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in keeping Ashland healthy.